Hope Channel, changing lives.
Be proud of who you are, not ashamed of how someone else sees you. Anonymous. Once again, good evening and welcome to the program Wounds of the Heart, where we're going to help you heal anything that is causing wound in your heart, that you are still thinking about how best you'll be able to let it out from your system. But today, I'm glad that you are once again joining me to discuss this beautiful, wonderful topic that probably you have never had any idea about. But today, my guest is already seated, but let me take this opportunity to thank you, the viewer, for all the time being there to watch this program, to comment and to share for other people also to watch. And those of us at home, thank you so much for all the time watching this program. I'll once again thank Slick Afrik for this fabric, Slick Afrik, Instagram, Slick Afrik, Facebook, Slick Afrik. If you want them, it's 0557 355 6852, 0557 355 852, and you call them, they will just drop it at your doorstep. And also Alpha Art, the one who always design my flyer, God bless you, Joe, wherever you are. If you need him, Instagram, he's there, Alpha Art, he's there. And the contact is 0551 404387. We are currently live on Facebook. You can go on Facebook, let someone who is at home to also watch, and that person to share the link for other people. And YouTube too, you can subscribe to our YouTube channel, Hope TV GH, and you can subscribe and watch and also recommend to somebody to share. 4th November will be 1 year, as I said, and we're still looking out for people to share your comment and your views via video, a 30-second or 1 minute, to tip to us how best this program has been impactful in your life and what you expect for the next year ahead. If you want to join in on our WhatsApp platform, if you want to contribute, the number is 0559 680066, 0559 680066, or you can drop your question or your contributions on our Facebook page and we will read them for you. My guest is seated, as I said, and I'm going for this break. When I return, I'll introduce her and we will set the ball rolling. Please stay glued to your seat. I'll be right back.
We want to defy our family's decision and get married or elope. I need advice. What should I do?
Please, what should I do?
How do I tell her I cheated on her months ago? I need help. What should I do?
Okay, so for me, the moment I read the story, the first thing that came to mind was, wow, knowledge is indeed power. Sometimes we go through situations because we have no knowledge of how to go about them.
If you come from a home like that, you are likely to accept anything the outsider would, direct at.
The fact that we had an interesting ceremony where a priest prayed and all of that doesn't mean that magically you have turned into something else.
If he finds his way to God, a Bible-believing church, and he goes and he wants to change, nothing is impossible.
His properties to charity and stuff?
Oh no, why? Okay, I think this is another discussion that we will not end today, so we know even go into it.
Real Talk, showing this and every Wednesday at 8 p.m.
Thank you so much for being there. Let me welcome my guest so that we can set the ball rolling. Mami Opeje Labi, good evening and welcome to the program.
Thank you. Good evening.
She has promised that whenever I need her and I call upon her, she will come because she also loves to help other people who are also going through having any form of mental issue, that she can also help reach those people by help. Once again, good evening, and I hope everything is okay.
By God's grace.
All right. I brought you here for a purpose. I want you to help myself and my viewers to understand and to know something about schizophrenia. It's a huge word, but
yeah.
I think that you by the end of this program and the next, we will understand what schizo means.
Yeah.
Basically, sometimes you see people talking to themselves, you see people acting weird, you see people saying that voices are talking to them here and there, seeing people in wherever they are, and we attribute certain things to spiritual or whatever. Please, I don't know, what is schizophrenia?
Thank you for having me.
You're welcome.
And good evening to our viewers too. Schizophrenia is one of the fascinating mental conditions, and psychiatry is still doing a lot of researches about it. And the fascination didn't start now. About 100 years ago, that was when it was first, an idea was created about it, but even then, it was still not clear. There was a psychiatrist called Emil Kraepelin, and then he saw that some people at a point in time do not act like we expect them to.
Okay.
You see people talking to themselves, being unusual from what they normally are. And then he thought this could be the beginning of old age that is manifesting earlier. And so he called it dementia precox, or the beginning of dementia.
Okay.
And then years down the line, another German physician looked at it differently, and he thought that, no, maybe it is the brain that is splitted. That's interesting.
How can the
yes, that is what he thought, because an intact brain is supposed to help us to think, interpret things, and be normal people. So he thought maybe there's a crack somewhere in someone's brain, and that is why they are not being so coordinated. So he coined the word schizophrenia. Schizo means split.
Split, okay.
Phrene means mind.
Okay.
So split mind means schizophrenia.
Okay, so that is how we got that word.
That is how the word even came to be.
All right, so we are learning, viewers. Schizophrenia. Schizo means split. And phrene means mind. So splitted mind, schizophrenia.
Schizophrenia.
Okay.
People argue that even the word is stigmatizing.
Exactly.
Yes, but that is how we got it into existence in the first place, and we have had to stick to that. But research has helped us to uncover more about schizophrenia, and by God's grace, by the end of this section, we should be able to know all that. We say schizophrenia is a severe mental illness. Severe. Because we characterize it as a syndrome. When we say a syndrome, it means the symptoms about it are in multiples and in groups, different ones that come together for you to diagnose schizophrenia. And before other researchers came up, we were looking at grouping schizophrenia into just 5 categories. The catatonic, the undifferentiated, the paranoid, and then the residual. And these types that we were looking at from then continued for a while, but as studies has gone on, we've realized that at times you can't even get one person exhibiting just one type.
Okay.
At a point, the person is in the catatonic state. At a point, they are being paranoid. At a point, you think it is undifferentiated. At a point, you think it is disorganized. At a point, you think it is another thing. So we are looking at it as a spectrum. When I say a spectrum, we are looking at it in graduation from this level to another. before we can even call it schizophrenia, and then see it as a management of certain symptoms which may come from any of the types. So it's a bit bulky to look at schizophrenia as one, but we still try as much as possible to look at which one is affecting the person. Even though all of them are schizophrenia, there could also be particular types, like the catatonic or the paranoid or the residual or the disorganized or the undifferentiated type.
So in the simplest term, for us to understand, splitted mind, schizophrenia, as a layman or layperson, what can I use to replace or to mean to understand what, as you're saying, that is a severe mental, how will I know this is schizo on my own, in my own term?
Yes, so that sends us to the signs and symptoms of schizophrenia. When we say someone has schizophrenia, you will realize that they may exhibit these or other signs and symptoms, and that is what I'm going to.
We'll talk about
the first one, we say, generally we divide the signs and symptoms into positive and negative types. When we say positive, what we mean is that the person is exhibiting some signs and symptoms that were normally not part of how their persona was. So we know a person that is staying with us, he's a kind that will wake up in the morning, say hello to everyone in the house, go to work, do their normal activities perfectly, close and come home. But at a point in time, they start talking to themselves, or they start misinterpreting some things they are seeing, or they are starting to believe in certain things that we know are not true. When they are seeing things, we say they are hallucinating, or they are hearing, or they are feeling things that are unusual, but they perceive those things. We call them perceptual disorders. So they could be hallucinations or illusions. I'm trying to bring these words to...
We'll come to the symptoms. But I want us to establish the fact that when you talk about schizophrenia, you are talking about a severe mental disorder.
Disorder, yes.
Okay. But so...
And it's characterized by a syndrome.
It's by a syndrome.
By a syndrome. Now, the syndrome is what I am trying to push us into slowly.
Okay.
I told you it's a whole complicated
I get that. I get
something.
That. Because my viewer out there needs to understand, needs to understand and knows that what are they talking about? What is that schizophrenia the woman is explaining? That will let me ask that. You said that had syndrome. So do they have types of schizos that we can relate to? Do you have types of schizo?
Yes, we have types. As I said earlier, the 5 main types.
Okay.
But the new fascination is the fact that some people may exhibit about 3
types of the types. 5. Okay.
Yes. And so at a point in time, you don't know if you should just say he has catatonic schizophrenia, or he has paranoid schizophrenia, or he has a disorganized schizophrenia. So what we do to help the situation is we look at the most prominent signs and symptoms that the person is exhibiting, and then we use that to categorize them. So looking at the paranoid one, the person becomes overly suspicious of their environment. So they think someone is planning something against them all the time. Or when you are doing something for them, intuitively they feel that what you are doing is supposed to end on a bad note. So even if you are trying to be nice to them, they look at you in a weird way because they feel this one that you are doing, in the end, is going to turn into a negative thing.
Let's wait. We have people, you meet people who will be telling you that I think someone doesn't like me. I think somebody hates me. I think somebody want to kill me. I think are these people? Is it part of what you're?
Yes, that's exactly what I'm talking about. So, someone with paranoid schizophrenia would think that everything going on around them is supposed to hurt them. So they are overly suspicious of you, the one that is doing that for them. Could be their relative or the co-worker or someone they're just meeting outside. But they feel and believe that this person is doing what they are doing to be able to hurt them. And this is not their own doing. It's the brain that is interpreting that to them. And it's making them think that once this action is going on, it is going to end on a bad note. So it makes them very suspicious all the time and pensive, because they feel if something bad is going to happen, they have to be alert. I have to be on the lookout, because this one that you fetched water for me, are you sure you've not put in poison inside? Okay, so you cook food for everybody and you covered everybody's bowl. Why did you cover it?
So these people always, the perceptions always lead them to think about things that it is not so. It's not so, and you know it's not true, but their brain tells them, convinces them that you are actually planning to do a bad thing against them. So that is their perception. Yes. So that's for the paranoid. Okay. Yes. And then we have the catatonic. So let's wait before the paranoid. So which means that such people would rush to church to tell their pastor that they think somebody hates them. They think
someone is planning to kill them.
And the pastors will start, okay, we'll get there. We'll get there.
So that's for the paranoid. They could just get up one day and say, I think people are planning to kill me, or my relatives are planning something bad against me, or I feel the people in my house, my tenants are planning to sell my house, or I feel my parents are planning to sell me to someone. All of a sudden, these thoughts start coming into their head, or even their best friend or someone close to them may be doing something that is very usual for both of them, but all of a sudden they get the interpretation that this thing that is going on is going to end on a bad note for me, so they start being suspicious of these people. So that is for the paranoid type.
Okay. Okay.
Yes, and then we have the catatonic one.
Okay.
The catatonic one could make the patient assume very unusual positions and refrain from normal activity. They may become mute or be sleeping at one point or assume very awkward positions and be comfortable in it. Someone could stand on 1 foot at a point and not move for 30 minutes. And they are comfortable, they are not moving, but they are there. Or they coil up themselves, I mean, maybe bring the feet up to the chest, coil themselves up like this. And they can stay there for 24 hours. And that is the catatonic type. Or they may become mute and sit at one place. If it is in the office or in the house, they sit in this chair and they are not moving the whole day. They're not talking to anyone. They are looking at one particular position and it is there.
Mercy, I think what your explanation is, it's clicking. A lot of certain things are clicking in my mind now. You see, one, I want viewers, please, let's take note of this. We're trying to help ourselves to learn, so that when we see set signs or when we see set people in this thing, we know that we need to help them to seek medical attention. Yes. One, with the paranoid, you said that they always perceive somebody is after them, somebody want to do them. They perceive negative thoughts about people around them. Yeah. With the catatonic people, also when somebody will call in a corner in a bed, will sleep at some corner, and he or she is comfortable there.
Yes.
In your office, that person will be idle, seated at one place, and be looking at one thing for a longer period of time.
Yes.
We need not to associate the fact that probably they've drank something but those things those people are doing are another type
of the condition.
Schizo.
Yes,
okay.
Mental condition.
Okay. So we need not to start pouring water on them or blah blah blah. We need to. So at what point in time do we do this?
If someone is in the office and is sitting at one place for a very long time, not doing anything, it's definitely interfering with their productivity.
Exactly.
And their social life as well. We have treated mental health here before, and we said the person that is exhibiting mental illness gets to a point where it's interfering with their personal and social life and productivity, at that point, that person needs help.
Exactly.
Because they don't see themselves. They do not realize that that is happening to them. Because the brain that is controlling everything that we're doing around us. So at a point where the brain is not communicating the right information to you, you're not able to tell that there's a problem.
Okay.
So it's the people around us that will be able to realize it and help. So if you realize that these symptoms are being exhibited by an individual close to you, and it's interfering with their social life. Social life because they're not able to talk to you again.
Exactly.
They're not able to talk to their kids again, their friends again. They are not able to socialize with people again. There's an interference.
Okay.
And then they are not able to be productive at work. They're not able to take initiative around them. It means at that point, there has to be an external help.
Okay. Okay, so that is for the
Tonic.
Tonic. So now we know paranoid, we know catatonic. What another type?
We have the undifferentiated. No, before we go to the undifferentiated, let's go to residual.
Okay.
Residual is the type where, no, let's go to disorganized.
Okay, disorganized one.
Disorganized one is where there's a disorganized thought in the person's brain.
Okay.
So they are not able to concentrate on things they do, and they cannot follow through procedures. So they will start something, and another thought comes. So they leave it, and then they go and start another thing. And as it's going on, another instruction comes into the brain. Stop, this is better, then they go. So when you go to their house, you realize that he was pouring milk, he stopped and went to the bedroom and picked a book. He didn't finish writing whatever he thought he was writing. Came back, put on the fire, put on a saucepan, probably in an attempt to cook. The fire is on, and they left it and went back into the room. So you see, there's a bit of a disorganization around them because the source of it actually is in the brain. There are disorganized thoughts in the brain, and that is causing them to exhibit those pieces of activities around them.
Okay. Okay. There's a question I want to ask, probably if we will treat it. Hello, my question is, how do you get help for a sibling suffering from mental illness? That one there is a brief. You need to. How do you get help for that person? Should
you
go
have to send them to the mental hospital. Yes.
Okay.
For psychiatrists to see them, because for you to be able to diagnose schizophrenia in itself is a long process.
Okay.
So we have to see the person, we talk to them, get the right information, know when it started, and be able to diagnose it and then get the needed help.
All right. Please, I always go absent-minded while doing something and talk to myself, even if I'm walking on the street. Is this schizophrenia?
For you to be, we'll get there. We'll get to diagnosis. We cannot sit here and just assume that is schizophrenia. But I'll now explain why we cannot just sit here and say it's schizo.
Okay. So, when we get to the diagnosis, you know we shouldn't rush, but your answer will be dealt with as soon as possible.
Yes,
thank you so much.
sure.
So, you were talking about the
disorganized one. So that is how you say it. Because there's distortion of thoughts in their brain, it's exhibited around them. You know, whenever you want to do something, you plan it. Even if you don't write it, you kind of say it in your head that I am going to the market to buy maize. When I come, I'll put it in water. After 3 days, I'll send it to the mill. That's a complete thought. And you follow through. Or it's morning, I have to wake up, go and bath, put on my clothes and go to work. I need to do some deliveries today. So I'll organize everything, call the dispatch rider and do that. These are organized thoughts. But in the case of a disorganized schizophrenic, they get the thoughts that I have to go to the market and buy maize. So they get up and walk a distance. When they're about to get to the market, another thought comes in. I think I want to do deliveries. So they leave that one. Probably it's just at the entrance of the market, but that's not a problem. They come back and start working on the deliveries. Probably in the middle of packing things, another thought comes in that, no, I want to go and visit Akosia. So they leave that and go. And so the thing that they were packing is in the chair because they took it from where it was supposed to be. And then they are going to Akosia and they realize, no, I don't feel like going anywhere. I have to come home. They get home and I think I want to wash. Let me just bring all my clothes out. And then they put all their clothes down. no, I'm too tired to watch, I want to sleep.
That's a disorganized.
That's a disorganized thought. And so these things are bumping in the brain like that, every piece of information, and it's sort of frustrating for these people, but they can't control it because it keeps coming. So if you're around them, you may start seeing that they are not able to take care of themselves because the thoughts that are coming are so much, and they can't correlate all of them at a point. So you see a bit of disorganization around them. Yes, all the time.
So when you go to somebody's abode and you realize that things are scattered, not necessarily forgetfulness, but it becomes that person's
lifestyle. And this is for a person that you knew was very organized or normal. I mean, we may get disorganized at a point in time because we are too busy. But I guess a point where we calm ourselves down and we collect everything, put them in their right places, and we are happy with it. But in this case, this person doesn't have that edge anymore. So they are not doing that. And the room is disorganized, but it's not a bother to them. They don't care because whatever is going on in the brain is much more of a pressure than looking at mattress on the floor or kids' diapers and stuff like that.
Okay. So I wonder if a schizo type, that disorganized type, is a driver.
That's a disaster. It is dangerous. And we have had those instances before.
Whoa, okay.
Yes. Someone that is schizophrenic decides to start driving. Imagine he's on the road and then something clicks that, no, okay, you just stop. And they
in the middle of the road.
In the middle of the road, they press on brake. That's about 10 cars behind them crashing.
Exactly.
And it's not their fault. But that is why for someone to be given a driving license, we have to do a lot more than just giving them a license online or somewhere because we think it is convenient.
Thanks for the educating us on schizo. What are the causes of schizophrenia? We will talk about the causes before we end, so please hold on. We will talk about it. Don't worry at all. Mami, continue.
Yes, and so that is for the disorganized. And then we have the residual. With the residual, some people, schizophrenia in itself, when we take the total population of people that suffer schizophrenia, we could have 1/3 of them recovering. The other 2 may have symptoms that will need to be managed throughout. With medication, people are able to control the hallucinations, the delusions, illusions, the positive and negative signs and symptoms. But some of them may not completely go. They may be there, but the good thing is it doesn't interfere with their lifestyle. So the person still hears voices, probably a particular voice that is called schizophrenia as a spectrum rather than just looking at one
side. Okay.
Because with the undifferentiated, they're exhibiting a bit of everything.
Okay.
Yes, there's a bit of paranoia, there's a bit of catatonia at a point, and then that goes away and you think they are settling, so it's residual, and then there's a flap back to, yes.
Okay.
So that's for the
So with these 5 types, which one, where do we place hallucination?
The hallucinations in all of them.
It's okay.
Yes.
Okay.
What actually makes it schizophrenia is the presence of hallucinations, delusions, illusions, and then the disorganized thoughts.
All right. Our viewers, I'll go for this break. When I return, we will talk about the causes of schizo, and probably the delusion and the hallucination aspect. She will talk more about it, how they feel when it comes to hallucination or delusion, that we will understand what schizophrenia means. Please don't go anywhere. I'll be right back.
Yesu pɛ sɛ ɔkyerɛ
hwe it is either senyame oni ye ebo mpu ni mpu a either so ye be or kyerɛ ye nyansa ana sa ye nyentin no ye no so. The devil's intention was to disgrace Christ, but God's intention was to fix a broken relationship. Hallelujah. How are you? You are being dear, but I get back on a minimum person with the mouth. So, obeying a mere. I should be done. About the issue.
Hello, my dear family, my friend, my big brothers and my sisters. Today is another day of family life.
School is an extension of the home. Then the teacher's role actually goes beyond just teaching.
Some people say that insurance is like a parachute. Okay? Insurance, you know when you need a parachute? When you drop from an airplane or from a cliff, and then just when you land, your parachute has to come alive and then carry you. So insurance is like that. If you don't have it when you need it, you will never need it again, because you are going to die anyway.
So when you let stress come over you and people are saying this, and because for our society, if you don't have a child, but please, you have your own timetable, and God have a special timetable for you.
Self-care is so important right now. If you are not alive tomorrow, you can't get the job that will be available tomorrow. So when you are going through all these job crises, whether you've lost your job, about to lose your job, or believe you are not even going to lose your job, think about your health first.
Family Life, every Thursdays at 8 p.m.
Welcome back from the break. Thank you so much for being with us. We don't have time, so quickly, before we go to causes, what are some of the signs and symptoms that will let us know that this person is suffering from
schizophrenia? Before we go to that, we mentioned that we now look at schizophrenia as a spectrum.
Okay.
Before we'll be able to diagnose schizophrenia, the signs and symptoms should be able to be seen for at least 6 months. 6 months.
6 months.
6 months.
Okay.
And before then, in some instances, some people may exhibit some signs and symptoms, but it ends before a month, that is 4 weeks. If someone happens to be in that category, we say it's schizophreniform. What it means is that it is a form of schizophrenia, but it is not the actual. Yes. And then we have people exhibiting psychotic signs and symptoms. We've mentioned psychotic signs and symptoms in the studio before.
Yes.
People having hallucinations and delusions, but they are not up to 6 months. Until we get to the 6 months, we are sure that these symptoms have spanned through till the 6 months, and then we diagnose as schizophrenia. So when you look at what I've said, now we call it a spectrum, because we say one thing happens, it may graduate to the next one, and then it goes to the next one. So it's a form of a straight line sort of something happening. And then these people that are exhibiting these signs and symptoms could be exhibiting paranoia in addition to the hallucinations and delusions, or the catatonia or other things. So we say schizophrenia looks more of a spectrum now than just a single sign and symptom being used to qualify something that has happened. All right. So that said, we're looking at
symptoms, the signs and symptoms.
The signs and symptoms. We talked about positive and negative signs and symptoms. Within that, we have hallucinations. We have illusions. Hallucinations and illusions are perceptual disorders. When we say perceptual disorder, it means the person can perceive something and is convinced that it's there, to the extent that they can actually respond to it. And one of such is hallucinations. And when we pick hallucinations, we have 5 different types of hallucinations.
5 different types?
Yes.
Okay.
We have auditory hallucinations. That affects their hearing. So they can hear a voice or more voices, either talking to them or discussing them. And in psychiatry, we say that schizophrenic patients are actually not violent in themselves, but it's a reaction towards them that makes them violent. And this is the explanation. A person that is hearing voices talking to them, it could be 2 voices insulting them. So I am sitting here and there are 2 voices telling me, you're not beautiful, you're not beautiful, you're not beautiful. The other person says, look at her, look at her. You're even carrying poop on your head. As you're sitting there, your head is even turned. In fact, the hairstyle you brought is even not nice. And I keep hearing this. At a point in time, if you believe that there's a voice telling you that, what will be your response? You must reply them.
Exactly, exactly.
And so if I am replying, I'm not replying the human being that is maybe sitting by me. I'm replying the voices I am hearing that is telling me that I'm not beautiful and I'm a thief or all the bad things. So when I am replying that, the person around me may feel I am talking to them. And then they come to attack me. You see how it happens? So when our patients go out there, people may attack them feeling or thinking that they are talking to them, but in actual fact, they are not talking to them. That is the difference between their stay on the ward with us and when they are home. We have patients that still have residual schizophrenia. They are still talking to themselves, but we know they are not talking to us, so we leave them, and they are still talking. When they take medication, sometimes it subsides. But when they are home, people may think, did he just insult me? He's not insulting, he's insulting the voice that is insulting him.
So when you're staying with somebody who always behave in that way for about 6 months and beyond,
you must take them to the psychiatrist and give them the right history. That is the trick. When you come and we ask, how long did it happen? Mostly we want people that are staying with them, because these people will give us a vivid information about it. So when someone comes and says, so I'm not staying with them, they just called me, it becomes a difficult thing to do, because we need to trace the history to be able to do the diagnosis. So that's with the auditory hallucination,
that affects
the hearing. And you know the body has 5 senses.
Exactly.
Yes. So hallucination in itself affects the 5 senses.
Like seriously.
Yes. So we have the sight, the visual. So with the visual, they are seeing people, probably chasing them or doing things that is attracting their attention. So you find someone that is doing this to someone, or they are looking at someone and they are doing that, they are flicking their eyes. It is because they believe they see something. You don't see it. We are not seeing it.
But they are seeing
it. They are seeing it. And it is the brain that is giving them that information, that misinterpretation. Do you understand? And so they are perceiving that there's someone they are seeing. So if you happen to get close, then they may tell you, I see someone holding a cutlass and chasing me. So you are in your house, you are staying with someone rushes out of the room, properly naked. You ask them and they say, there's someone chasing me with a machete. And we are puzzled because we believe there's no one there, but they strongly believe there's someone chasing them. So that is that with the visual. And then...
Mercy, wait. You are helping me to understand, and my viewers out there to understand something. We need not to neglect or ignore friends or loved ones who start behaving in what you're saying.
Not at all.
Because at the end of the day, if they can see and they will tell you, look at them, don't you see them? We shouldn't just laugh it off. We shouldn't just tell them they don't want attention or stuff like that. But rather we need to take it seriously and start checking up on them and see how
getting them the right help, because you see, it is one of the most difficult disorders that can happen to anybody, Because if nobody is seeing it, but I'm the only one seeing it. And what I am seeing is actually threatening to kill me. I'll have to run for cover. And so you are in your room and I barge inside and I want to hide. And you are frustrated because I barged into your room. Or you think I am invading your privacy or something. At that point, that patient needs help.
Exactly.
They feel that they must be protected and that is why they're running. Or they feel someone is following them, or this particular, the CID is following them around. And they can actually give you a vivid picture of somebody that they are assuming, a figure. And they believe that figure has followed them from work through to their home. And then even when they are bathing, they feel that person is standing there and looking at them. And it's frustrating to the patient at that point. So that is for the visual.
Okay.
And then we have the gustatory taste.
The taste, okay.
Yes. They may start tasting different things. So we are all drinking water. This is a bottle of water. So you drink it, telling you when he opens it, it's urine that is coming out. Or at a point in time, he says it is blood that is coming or something. And they taste it. When he drinks it, it turns to blood. So he's not drinking from it already.
This person you're talking about, visual, that person is...
Yes, he has a visual hallucination.
The taste.
He has a gustatory one too. So he believes when he opens the tap, he sees blood coming. When he drinks it, it is blood, so he doesn't want. But the funny part is that the same pipe that is supplying all those taps is the one supplying the one he has chosen.
But
he believes
schizo, whatever.
Exactly. So you see, with schizo, at a point in time, they do weird things. This is one of the weird things. He believes all the other ones. Or they could even choose a particular bowl and believe that all the other ones you put poisons inside, but this one has no poison. And this is what he wants. Just let them be. Give them that and they're okay. So that is with the gustatory. So it affects what they eat, anything that goes into the mouth. Or when they are there, they may start tasting weird things. They think they are eating probably a cake or vanilla or something. Yeah, so that's for the gustatory. And then we have the olfactory, that is the nasal one. Their smell. They may start feeling that their room smells so bad. Or the person that is passing by them smells. Or maybe their mouth smells so much and is getting into their nose, or their body smells. Anything that the nose can pick is misinterpreted to them.
I'm interested in this part. So at a point where you, with the person, you know that there's no smell, there's no smell. And the person start telling you that he or she feel smell in it weird. You should start tipping those people and start checking up on them because it's not normal.
That is, initially, you have to confirm first, is there a smell? Is there a smell?
So if there's no smell.
If there is no smell, then probably something is going on.
If they themselves are not smelling, then they still think that, or tell you that.
No, if they are not smelling, they won't think. In actual fact, they are smelling. They think, they believe there's a smell.
No, but with those
you are not smelling it, but they believe that the smell is there.
So at a point in time where there's no smell around them.
To you or to them?
To me.
To you,
yeah. The one you are, because I'm saying this because we might be living with somebody that will be exhibiting what we are saying. And how best do we know that, okay, at this point, the person is suffering and we need to tip him for mental...
so if you are not smelling that and you are very sure, probably you may want to get a third opinion for someone to also come to the room and see if it is true that there's a smell. And if you've confirmed that there's no smell, then probably we're looking at an olfactory disorder that needs to be attended to. Yeah.
Okay. You can keep your questions and because this is a whole school on this studio. I just want to know, Mercy, one, those who are in charge of hall deans or hall president or house masters or house mistresses. At a point in time, students will be feeling these signs and might think that the SU people need to take charge. Prayer warriors need to take charge. But probably it's a mental illness that should be treated ASAP. So this education should go to set people, for them to understand that when they see these signs and these reactions from people, they should be very...
should be concerned.
Exactly. All right.
In actual fact, all of us living with people should be concerned about this information, because at any point in time, someone might
exhibit something.
These things. Okay. Yes. So then we have the tactile. The tactile is about touch. People with tactile hallucination feel that there's someone touching them, or there's something crawling on their skin, or there's something unusually touching them. So you may see them trying to to push that thing away or something. So if you have witnessed it, I'm sure my viewers may remember someone that is always trying to clean something off their skin or something, or feel there's something crawling on their cells and trying to so that is the 5
so with the tactile, the latter part you just said, thinking that something is
crawling on your skin.
Someone actually will tell you that when they woke up, they saw those signs and marks on their skin.
There could be accidents. That is different. What I'm talking about is
sleeping, as in those who hallucinate. You could see that there's nobody in the room, but they are telling you that person is standing there. And that same person, if that person is telling you that he or she slept and woke, saw that a snake, whatever, has entangled him, or my hand, and she woke up to see that the stretch of the arm, or he woke up to, and when you also go closer to, you wouldn't see anything. That person should be tipped for mental.
If you're not seeing anything, but they still believe that it is there, and they are so concerned about it because that is the perception they're having, then that person may need help at that point in time. I have a patient who believes there are animals crawling under the skin. So when you don't pay too much attention to him, at the point you go and you see that he scratches the skin, so he sees blood. They can go to that extent.
Okay.
Or someone believes with the olfactory disorder. Some people believe they smell so much. They have bought every perfume that they see because they believe there's a smell, and the smell has to be taken away, and they have to do it by all means. So anything, perfume, they are buying.
They are buying because they think that it smells. So when you see somebody like that who thinks that he or she smells to the extent that she'll be buying perfumes, all perfumes, please, let's help the person by probably, is it whether calling the mental health or trying to let him or her go see mental health practitioners, so that at least they could know the story background and try to, because it's not normal for somebody to think that he or she smells and I will buy all the perfumes in the world too.
Yes, but some people do. And you know, in some instances, what a person needs is a psychologist to let them know what is happening to them. Some people are actually living with schizophrenia, and they're just functioning. They know their symptoms. When you go to the Western world, some people accept that they have schizophrenia. They are going about their duties. So the person has an olfactory delusion, hallucination, and they know, I mean, it is my brain telling me I'm smelling. So if I wake up in the morning and I bath and I use my roll-on and everything, I should be fine.
It's because they know, right? It's because they know. But we here don't know what schizo is. And that is why you are here telling us.
Exactly.
So from today, when I should see these signs or symptoms being displayed by somebody closer to me or somebody knowing, I need to help the person by telling the person to seek medical care. Because at the end of the day,
counselor, psychologist.
One thing I'm so much, the tact expert is those who always think there's mosquito bite, there's something, and they will be cleaning themselves publicly. You will see them, and we will tempt them to be ahia. They are distant, but apparently what they are going through would never be a normal thing for us. So when we see these things, we need to make sure that we help set people to seek medical help.
Yes,
all right. There's a question here. Let me ask. We see how to end the show today because it's time. Good evening. This is Pastor Richard, located at Sandema. I'm currently watching the program. Thank you so much, Pastor Richard. Please, my brother, who is a teacher, is suffering from mental illness. for more than a year now and sometimes become normal, later goes back?
So probably he's having a fluctuation, or probably he's having a residual.
Okay.
So if he's on medication, that is fine. But if he's not, then he has to go to any of our centers. We have a lot of community psychiatric nurses.
Okay.
I'm one myself. Yeah, I've trained as a community psychiatric nurse myself. So people are in units attached to our general hospitals. So go and see them. They may take you to the psychiatrist for an evaluation, and when you are sure that is what is the problem, then you may be put on a medication for a while. If you need to go off it, they'll work on it and take you off. If you are fine without it, you just need counseling on that. Everything is done for you like that.
Okay. So these are some of the signs and symptoms you're talking about, the hallucination that affect all the senses, the smell, the taste, the visual, or stuff like that. So we just should be mindful of these things. For us to know schizo is real or schizophrenia is real, these are some of the things we need to add. All right. Are there risk factors to that?
Yes, there are risk factors. Let's look at the causes, then we'll put in the risk factors into
your time is up.
A lot of things could actually cause schizophrenia.
Okay.
But as it stands now,
exactly,
nobody knows the actual cause of schizophrenia.
Okay.
We are still doing researches about it, but we look at some factors that contribute to it.
Okay.
As it's now, we don't have the main cause or something we can pinpoint as this is definitely the cause. But we look at some things that are in the environment, some things around us, some things that lead to someone getting schizophrenia. And it spans from our genetic makeup, our environment, or even the substances that go into the body. So with the genetic makeup, from birth, no, before pregnancy.
Before pregnancy, okay.
The genetic makeup of your parents could make them transfer something like that to you. One thing that is fascinating about genes is that one gene could be dormant in one person, but when they give birth, it becomes obvious in the child. So if you have the predisposition of having an inherent gene that could make you have it, you could get schizophrenia. I said could. It is not definite.
All right.
And then brain structure. There has been evidence of people who have malformations in the brain exhibiting schizophrenic signs and symptoms. And then we have the neurotransmitter theory. The neurotransmitter theory, the neurons and the chemicals in the brain, we have different types. An over-secretion or under-secretion of a particular type could cause someone to exhibit abnormal signs and symptoms. So that is also a factor.
You use over-secretion and under-secretion. Yes. I don't know how my
of a particular
what does that mean?
Neurotransmitter. Over-secretion, the brain may produce more than necessary of that particular neurotransmitter. The neurotransmitters, in simple terms, are chemicals that helps to send impulses through the brain to be able to communicate the right information to the right neuron to transmit it into an action.
So when I'm hungry, there should be a transmitter from the mind to tell me that, to tell the system is hungry.
Yes, you're hungry. And then the neurotransmitter sends the information to the brain. The brain tells you you're hungry. It sends an information down. The stomach starts secreting juices, tell you that the body needs food. That is a normal one. In an under secretion, the body is not secreting, the brain is not secreting that, the relay is not coming, your stomach is not telling you you're hungry, so the body is not putting in food and you're losing weight.
All right, let's hold on to what she just completed with or concluded with. The over secretion and the under secretion. That at a point in time, the normal person, the system, the neurons should tell you what to do at a particular point in time. But if the neurons are not connecting or contacting with any of the point or cells in the system, then it means that that person is sick.
Yes.
All right, viewers, we are still talking about schizophrenia. Our time is up, and we will next week, if God permit, Wednesday, we're going to talk about the causes there and how diagnose and how best we can help people living with schizophrenia. And I'm trying to get a pastor in here for the pastor also to talk to us. When should we administer prayers on such symptoms, and when do we take them to the mental hospitals for mental clinic, whatever they want to. So please, this is a topic where it's new to most of us, and we are hoping and praying that by the time we are done with this schizophrenia topic, all of us will become abreast with it and will help us to help other people who are going through schizo. I would like to thank you, the viewers, for a wonderful support from day one of the program till now. And I'm telling you that on the 4th of November, Wounds of the Heart is 1 year, and we're going to celebrate it in the grand style. We need your input as well. If you know that the program has been impactful in your life, you can share your testimony, a 30-second or 1-minute video, and that they want to tell the world about how the program has impacted your life and what you've gone through. And you can also add your expectations, how you want us to go to the next level when it comes to Wounds of the Heart. And also, Slick Afrique, God bless you for the fabric all the time. If you need Slick Afrique, Facebook, Slick Afrique, Instagram, Slick Afrique, and when you call upon them, they will deliver it at your doorstep. Alpha Art, the one who always do my flyer, God bless you. Joe, God bless you. If you need him, Instagram, Alpha Art, and ALPHART, he's there. When you go on the social media and call up him, he will just give you a good design for any other thing. And now we are also seeking for sponsorship for this program. We want to take this program far. So if you want to support in your own way, not a huge sum, but any support you want to give just to put this program up there, to invite more guests to this program, you can drop your contact and my team will talk to you from there. Mame Mercy Apioje Labi, God bless you for coming all the way from Pantan just to make sure this program becomes successful. And we know that next week we are there. I know schizo is a huge topic that probably we can even take 1 month or 2, but I know that by the grace of God, we're going to break it into 2 and complete next week, Wednesday. Thank you so much, and God bless you for coming. Please, next week, I want to see you live. Live good, be good. Stay safe and blessed, and may the power of the Lord continue to be with you. I've been your regular host, Pastor Daniel. I'm out.